One day I'm going to do a video with some of my therapist friends about some of their pet peeves. I think it will really be funny. One of the pet peeves that I'm thinking of right now is when a client comes to session and they don't know what they want to talk about. You called me for a session. I didn't pick up the phone and call you. Okay? So when you come to therapy, have some idea of what you want to work on, what you want to talk about. Now, I am not a talk therapist. I am a trauma therapist. So a talk therapist, you can talk about your daily life events. You can talk about la 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 la. That's not an area that I like to work in. I want to get to the root of the issue. Here's why. God has given me a gift of healing. And I want to use that gift for those who want to heal. Do you want to get well? If you do, and that's scriptural, if you do, then I am a person who God has given a gift to help you. I'm not going to struggle with you. I'm not going to struggle to pull it out of you. If you are initially coming to session and just don't know, I'm probably not the therapist for you. I work well with other therapists who say, you got a trauma piece. Let me see if Yvonne has an opening and she can work with you on the trauma piece. And then I do that, and then I send them back to their regular therapist for talk therapy. So sometimes clients will start out the gate with wanting trauma therapy. So, and sometimes it's their first session ever before a therapist. I like working with those clients. Here's why. Because I really want them to have a really good experience with therapy the first time. That's number one. And then I want to educate them. I do a psychoeducation piece about where trauma is stored in the brain and the body, and how we can process that trauma, how we release trauma. The primary way that we release trauma is through tears, through crying. I can't tell you how many clients cry on the first session because they're in a safe environment. They can be vulnerable, and then I'm easy to talk to. I have that gift too. I'm easy to talk to, so they release. And that's when healing can begin. And because I want to help so many people with this message of trauma education and helping them heal, I don't want or like to spend a lot of time pulling information out of people. Some therapists are more gifted at that than I am. That is not my purpose or calling. So know the kind of therapy that you want to engage in before diving in to a trauma therapist or someone like me. I want to help you. I want you to have some idea, though, of what you want to work on. This is especially important if we don't know each other. Because if I know you or know some history about you, then it's easy to say, oh, remember, the time that your mom left you outside the hospital. It's easy to start with something like that. And I would say, notice how you feel when you talk about that. Notice where these emotions come up. Do you feel it in your body? Throat, chest, gut. And then we work from there. But please, 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 when you go to therapy, and everyone needs therapy, have an idea of what you want to work on. In other words, when you go to therapy for that first session, have an idea of what it's like to feel that that session was a success. That's it. Just know what you want to work on. Thanks.